Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner. I'm joined today, as always, by my very gobblery, gobble, 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 co-host Dr. Jason Martin.
Jawline. I don't have a gobble neck.
No, that's different. Turkey trottery. Turkey trotting.
Two meanings, gobble and gobble.
Yep,
Yeah.
Co-host Dr. Jason Martin. He's
Yep.
board certified plastic and reconstructive surgeon. He does
very
not have a
board
goiter.
There you
That's
go.
different than a gobbler. Some of our patients will say that, though. My gobbler, my goiter. That's direct excision neck lift. Go find that episode right here.
Right there.
If you were
Just
listening,
did one 2 weeks ago, and the guy's super happy, by the way.
if you're listening to this podcast and you would like to watch us, you can find us on YouTube at Jason Martin MD. We're also on all social media at Beauty and Surgeon Podcast. Share us, leave us a comment. We love it. It helps everybody find us. And, it's Thanksgiving. It's the season of giving. So give us a little love.
Give us some love.
Show us some love. Put a little turkey in our comments.
Do the notification thing where you get the bells and everything that we do.
The
Is
bells.
awesome.
Just leave us a turkey. Seriously, throw that little turkey emoji down there.
emoji.
Yep, that would make me happy.
Next to the pulley emoji.
Yep, pulleys.
Turkey pulley.
My baby pulleys.
Yeah.
All right. So this is part 2 of our thigh lift, everything you know about thigh lift. So if you did not listen to episode 1 and you're considering a thigh lift, we talk about how to choose a surgeon, different types of thigh lifts. This episode, we're really going to get into the nitty gritty of the actual specifics of the surgery, the risks, and also post-op.
Which the post-op is probably the biggest part of all this stuff, because if you go to a competent surgeon, you're going to have a good result, but you got to prepare.
Yeah, we talk a lot about special considerations in the first episode, and thigh lifts, above all other surgeries, have more of them. So definitely, if you know someone or you are considering a thigh lift, listen all the way to the end where we talk about risks, post-op, how to recover, all that good stuff. So let's jump into the step-by-step part, Dr. Martin. This episode 1 is usually heavy on me. Episode 2 will be heavy on me at the end, but
No, it's
just
good.
4 basic steps, like real basic steps.
How long have we
of
worked
surgery.
together, Amy?
16 and a half years.
Yeah, I think you're good. You could take this episode. So
I think I could.
yeah, you probably could.
I'm going to do your facelift later.
Right.
It's
so
cool.
when you think about so we've had the preoperative appointment, we've done the risk and benefits, and we've talked about everything we've planned ahead. And it's the day of surgery. You show up, then you go to the preoperative holding area, and everyone sees you, and they talk to you about what's going to happen. The anesthesiologist will talk to you. The nurse will evaluate you, make sure you have all the paperwork in there, and then the surgeon will come in and mark you, and the markings will be dependent on the surgery we're doing. When the anesthesiologist talks to you, and this is step 1, if you look on our YouTube channel, they'll talk to you about the anesthesia they're using. There's 2 types of anesthesia you can do with this surgery. There's sedation, right, Amy? Mm-hmm. And then there's general anesthesia. So I think this gets a little bit over perseverated. Mm-hmm. I think that people like a deep intravenous sedation and a very light anesthesia are pretty similar. They both use propofol. So I don't think this matters too much, but it just depends on what the anesthesiologist thinks you need. It's going to be a couple hour surgery no matter what happens. So sometimes they'll want to do anesthesia, especially if you're going to be turned in different positions while you're asleep, or general anesthesia. Intravenous sedation is also a good option too. So it's anesthesia preference and surgeon preference.
And you'll always get local anesthesia as well. Like we don't, even when you're asleep, completely asleep with general anesthesia, we still numb up these areas. So there will always be that as well.
Yeah.
No matter what kind of anesthesia you have.
So once you're marked, and you're marked for the incision. So step 2 is the actual incision. This is actually really working well. It's like you've done this before.
It's like I've done this before.
Yeah. Once you're marked, we take you back to the operating room and you go to sleep, whatever anesthesia they're going to give you. We reposition you in the bed and we prep and drape you. And Amy always describes that as we sterilize everything. So the type of incision we do, and by the way, we inject local, as Amy said, and then we make the incision. The type of incision we do is dependent on your presentation. So, Amy, let's quickly just go through the different types of incisions.
Yep. So episode 1, we talk about basically you need the incision you need, but there's going to be a full or a medial or an inner. There are variations of those. A spiral, which is like a really extended full. There's also an extended medial or an extended inner. If you need an outer thigh lift, you're probably also getting a body lift.
Do you think I'll be motivated enough to draw something to put on here?
We've drawn it before, haven't we?
Okay, we'll find it. Yeah, we'll put it right here. So this will show you, or Nils will cut to it, the different types of incisions that are there. And that's really helpful. Mm-hmm. And, if you think about it, if you're the patient listening to this, like I definitely want a thigh lift, you think you need it. Really, the medial or inner affects the upper third, as we said last episode. The full affects the whole upper thigh from your groin to your knee. And then you can extend that up in front to your belly or back around along your butt crease that goes around to your saddlebags.
The gluteal fold, the butt crease.
The gluteal fold.
Gluteal fold. Yeah. So with the full or
in my old days when I learned all these words, I said all the medical words, and then we started the podcast, and you got
and
on
you started
me.
saying things like butt crease.
Well, because you got on me, because like no one knows what this is and that is,
It's
and then
for me.
yeah, I'm trying to humanize medicine and connect with the common man.
Yeah.
Yeah,
So,
it's a gluteal fold. And by the way, I don't say butt crease when I talk to other plastic surgeons or anesthesiologists.
yeah. But a full
Only to Sarah.
a full thigh lift is going to be from somewhere in the groin, right, where the pubic bone is, down to the knee. Now that may extend above the knee or behind the knee slightly, or even down past the knee just a little bit. And if we're talking a spiral thigh lift, like think about it kind of wrapping up around. So that is going to maybe wrap all the way around to the gluteal fold and straight up, like through the pubic hair area, ending like at where a very low bikini would hit. So kind of straight, like that lifts the whole leg all the way around. A medial or an inner thigh lift is going to be more focused on the upper third. So it's going to stay in the upper third. It's going to stay right around the groin, maybe extending into that gluteal fold and likely up again, straight up through where the pubic hair would be to where a very low bikini would sit. And that, allows us to pull. You can't just pull the front of the leg. You don't just want to pull just the medial. We've done that before, like maybe a mini medial. You could do, like just almost like a horseshoe incision kind of. We've done that. Yep. Without any extension. So, again, your doctor is going to tell you what type of incision is right for you. And you don't need to know these names. You need to know where they're going.
You need to know where you have loose skin and fat that you want taken care of.
And how far your incision,
and how comfortable you are with having incision that's longer or shorter. Mm-hmm. That's basically it.
Yeah. So the work, then what happens?
Oh my God, it's a lot of work.
It is a lot of work. It's a lot of incision. I mean, like most people's legs are pretty long.
Because let's think about this real quick. And Amy, we're closing our eyes. Are we thinking?
Yes.
Okay, good. So, Sarah, are you thinking? Okay, good. So you close your eyes. You think, okay, I'm working around the thighs. So you're working in that invaginated area between the labia and where your leg meets your pelvis. That carries around to the gluteal crease. Thank you,
gluteal
Dr.
fold.
Body.
Yeah.
Okay. And it can go up front next to your pubic hair and then along where your bikini line would be. Mm-hmm. It could also extend down the leg to the knee. But specifically around the groin, around the labia, along that gluteal crease, you're working really deep, invaginated areas. That's very uncomfortable. It's hard to work in there. You have to contort your body around.
Well, and you have to be able to move the patient. That's where the anesthesia choice might come into play because there's a lot of manipulation of the joint to make sure that it's in the right position to remove as much skin as possible, but still allow for full range of motion of that joint.
Allow you to bend your joint and so you can actually
laterally
sit on
rotate.
a toilet at some point. Yeah.
Yeah.
So it almost always, at least with me, it includes liposuction of the area that you're treating, liposuction of the thighs themselves.
And you do that
of the knees.
before you remove the skin.
You do the liposuction first, then you make your incision, then you elevate your flaps. Then you
which the liposuction helps with.
Remove the excess skin, usually done in aggressive but conservative fashion because you don't want to remove too much skin. So you start having a problem, which we'll talk about after surgery, which is called dehiscence. And then you inset everything with these deep sutures. That's a big part of this surgery. I think we have a thigh lift episode. It's actually our most popular episode.
We have two. We have thigh lifts and we have thigh lift 2.0.
Oh, okay. Mm-hmm. Well, they're popular. And I talk about this deep suturing technique, which is in something called the superficial fascial system. Which is in plastic surgery, those deeper layers of your soft tissue before the muscle that hold the skin together. You put these deep permanent sutures in and you can go to your plastic surgeon and they're going to tell you their amazing way they do it. Okay.
Oh my gosh. We've had some thigh lift patients go way down the rabbit hole on this. Like, but do you do this specific suture in this specific location to anchor it specifically at this muscle, bone, joint? Like, yes, but it is important. And it
is important. So you really have to anchor it into thicker, deeper stuff.
You're fighting gravity.
Yeah. And there was a guy actually in the early 2000s, I've talked about him before, Ted Lockwood, rest in peace, he died. And he came up with this. It was really revolutionary in our field that you can find these deeper, stronger layers of soft tissue and anchor them to areas of strength. And you can maintain, number one, the flat position and also maintain the scar so it doesn't spread and become problematic. And we've talked about this many times more before with thigh lifts. Spreading, especially around your labia, is disastrous because it can spread open your labia majora, which can be uncomfortable and lead to distortion and something that doesn't look good. These deeper sutures are absolutely necessary. If you don't have those, it's going to be a problem. And I don't know what to tell you. And they're hard to put in and they're technically difficult to do. So please just go to someone who does these on a regular basis.
Yeah.
You redrape the skin, remove the excess skin, and then you chase out everything. And that's where the tailoring comes in. We've used this analogy.
We learned this. One of our listeners told us it is not a tailor. We had this conversation on an episode, and it's Stitch and Granny or something. I thank you so much for commenting if you're listening. She told us that it is called a sewist. That is the gender neutral term. So male or woman, male or female, it is a sewist. It is no longer a tailor.
We were going to refer to it from a sewist from now on.
Sewist.
I'm going to use this in my daily life.
Yep. So thank you for telling us that. Stitch and Granny or Stitch and Grandma. I don't know. Thank you.
So for closure, you place drains and then you do 1,000 million sutures. I actually add staples at the end, which are my insurance policy. People always ask how many sutures you put in. I put so many in, I was delirious. I was like...
there's probably 100 staples.
I was Will Ferrell at the end of Old School when he's done with his test and he wakes up. He's like, what just happened? You know, like there was so much going on there. And you wrap things up usually in a compressive garment or an ACE wrap and wake you up. And usually when you wake up, you don't have too much pain because everything's localized, has local anesthesia in there.
Yeah, and even with that, we'll talk about more in the recovery. This is not a surgery that people complain about a lot of like acute pain. It's just a lot of uncomfortable tightness and a lot of uncomfortableness.
One of the more uncomfortable surgeries we do.
Yeah, by far. All right, so surgery's done. Hopefully you reviewed these risks and complications prior to surgery, but let's talk about what some of them are. And a lot of them are things, and the reason I put this after surgery is because they're things that can happen after surgery. It's unlikely that you will have a risk or a complication prior to surgery. You might have risk factors, but these are things that can happen after surgery that are definitely considered a risk or a complication of this surgery specifically. Anesthesia, risks of any surgery. These are the risks of any surgery. Bleeding, infection, need for additional surgery, etc. Literally the same whether you're having a thigh lift or having a tiny little skin cancer removed. You can have bleeding, get an infection, you can need more surgery. Those are risks of any surgery. The things that I think are really specific to a thigh lift, we talked about skin loss. We didn't talk about changes in sensation. You know, you can have pressure, at least right after surgery, because of swelling or just because of the tightness on nerves that can cause numbness or tingling in the foot.
And you will definitely have numbness in the areas of surgery for a long time. And think about that's your inner thigh right next to your like labia. That's your gluteal crease, and that can be disconcerting for people. You can definitely have bleeding in this area. When you create raw areas and after surgery, people have pain, discomfort, they have nausea, they're retching, they're throwing up, Valsalva kind of pressure bearing down. Those can cause and lead to bleeding. These
or
can
a
be
fall.
Yep.
Yeah. Oh.
Fluid accumulation is a big problem here called seroma. Those build up in these pockets of rawness underneath the skin.
Rarely, and I say as knock on wood, get issues with seroma after a thigh lift.
Right, and that's usually the more medials don't have as much elevation, but when you get into the fulls, that's where the seromas can be a problem.
Especially with the additional liposuction.
Yeah, the big thing for me personally is deep vein thrombosis because it's life-threatening. Deep vein thrombosis is clots in the veins, the deeper veins, usually in your legs, could be in your arms, could be anywhere because of the fact that you're not moving around. Those can travel to your lungs, cause pulmonary embolus, and lead to loss of life. Pain, definitely there.
Which may persist.
Yeah.
Pain that really lingers.
I think the main issue with these that are like, if you go to a reputable surgeon and they get you to move around and maybe even put you on something called Lovenox or low molecular weight heparin, the likelihood of deep vein thrombosis is very small. The thing that Amy and I get concerned about, even with good surgery, is wound healing issues and skin loss. Yeah, and something called dehiscence. So I'm not going to spell it.
It's just an opening up of the incision, essentially. The incision does not union. It has a non-union.
And we've had tons of patients, fortunately not ours, come to us, help, because I had a dehiscence with, can you help me fix this, after the surgery.
Yeah, a patient with a thigh lift in Colombia by a great surgeon, someone that we know, really good surgeon, had some dehiscence. And I mean, it's a long, it's a bit of a challenging area to heal because it's in a
8-week process of healing.
Yeah, it's in a warm, somewhat moist environment, not great for healing. And it's also very prone to friction, like Dr. Martin said, or rubbing against itself. Skin on skin is not a great way for things to heal. It's dark, it's moist, like there's a lot of things working against you. If you do get an area of dehiscence, it's just going to take longer to heal than on potentially other areas of the body.
Right.
And that's annoying. No one wants that. I mean, go back and listen to our Doc Size of Plastic Surgery. We want to get that shame spiral of what have I done? Have a dehiscing wound. Like, oh gosh, you're going to think you made the worst mistake of your life. But you didn't. It heals.
It heals just fine. Yep. If you do it right. If you do good wound care.
Yeah, absolutely. We've never had to revise a scar from a thigh lift. Even when we thought maybe we would have to.
That's pretty crazy if you think about it. How long have I been in practice?
well, I mean, we've been working together for 16 and a half years, and you were in private practice for almost a year before that, like 6 months before
So
that.
We've never revised a thigh lift scar, which is insane.
Yeah, they really do heal well. I mean,
And that's the truth.
part of that's just the slowness of how it heals.
Yeah.
It heals better. Deep suture extrusion is something that can happen. Like because we do
Say
so
that
many
again?
layers, deep suture extrusion,
It's a tough one.
extrusion, deep suture extrusion.
It's a little-
Hey, no Kentucky jokes.
I mean, apparently I become Southern when I say that.
Man, when you get a deep suture extrusion.
It's not good. But this can happen just because there are so many layers, as Dr. Martin discussed, and a lot of them are in very soft tissue areas. So eventually your body can kind of be like, what are we doing with this thing? And start to push it out. And that can pop through the incision line even months or even a year after surgery. A big one that none of us want to believe is real, but that is definitely something that's a risk. It's not like it's a bad surgical thing in most cases, but you can have recurrent skin laxity.
And that's not uncommon.
Right? What led you to this place will lead you to this place. We talked about this in our first episode. A thigh lift cannot stop gravity, cannot stop aging, cannot stop the unique things
Besides
that
the
brought you here.
massive weight loss, if you're just someone with really loose thighs, there's something genetically inside of you that allows you to have really loose thighs.
Yeah.
And just because you tighten everything doesn't mean that process of laxity and looseness can't happen
Right,
again.
10,
It's not
20
going to be as
years.
bad, but it definitely can reoccur. And that can really make people frustrated. So, I mean, it's something we talk about beforehand, so they're not surprised.
Yeah. And an unfavorable scar or scar location, like the scar may stretch or migrate a bit, and that's not great, or it can just not look as good as you want. In most cases, that can be completely fixed. We have a great episode on scar revisions. Scars can be fixed. Asymmetry is another one. Again, these are not life-threatening things, but it's definitely a risk to know. There are sometimes in some of our patients, the way that their hips are rotated, or like a slight rotation of the pelvis, that kind of cause their leg to angle a certain way, so their legs don't look the same. But you don't notice it about yourself when there's a lot of excess skin and fat, and then all that skin and fat's gone. You're like, well, now this leg looks a little weird. It's like, well, that is just your leg. So there
And you
are
could
some
definitely
things,
have long-term swelling on one side over the other. And
some persistent edema. Yeah, there can be asymmetries.
By the way, swelling and bruising is definitely something you're going to have with
Yeah.
the surgery. It's not a risk or
Yeah, that's not.
complication.
No, that just is.
That's just a
That
reality.
just is. Yeah,
Yeah.
that's just a reality. So let's take a quick break, and we'll be back to talk more about the risks, or about the recovery and post-operative period.
All right.
So, Dr. Martin, I got something super exciting to talk to you about.
Yeah, what do you got?
Well, it's actually something you and I were talking about earlier in the day, which is this awesome supplement that we've both been taking called Magic Mind.
Yeah, I actually really like it.
You want to talk about why you like it, then I'm going to talk about why I like it.
Well, I like the whole backstory. The backstory of it is what really hooked me.
You love a good story.
Oh, yeah. I mean, so you have this entrepreneur, like a Fortune 30 under 30 person. He had this company called, I think it was Tilt, and was building up the company, working late hours, drinking tons of coffee, and was 26 years old, and then started to feel terrible, saw his internist, and then ultimately ended up in the emergency room and had something called atrial fibrillation. It's a real problem. Your heart's not beating right. Your atriums, the chambers of your heart, aren't beating correctly.
Misfiring, kind of.
Yeah. And he had to have cardioversion. This is not a HIPAA violation. This is literally he divulged this information. Afterwards, they said you can't drink any more coffee. This is a super driven guy. Do you know anybody else like that?
No.
Any type A person that likes to drink coffee? Have you ever met that person before?
No idea who you're talking about.
And so I was reading the story. I was like, oh my God, this could be me. I drink tons of coffee. It's part of my life. And what do you do when you drink tons of coffee and you're that person that's motivated? What can you substitute for that?
Well, so that's actually what got me interested in this. I am a nutritional therapy practitioner, as listeners of our podcast know, and I am also doing a Best Year of Your Life challenge because it's a big year for you. And I was getting to a place where I was drinking, because I love coffee, but I was also having some pre-workout. And then I was like, ooh, I need a little boost in the middle of the day. So I found this pre-gaming supplement that was full of nootropics and adaptogens, but it also had a ton of caffeine. So what I found with Magic Mind was that it has all those same things. It's full of matcha. It has adaptogens, which are things that kind of help your organ systems function a little bit more appropriately or in sync with themselves a little bit better. Also has the nootropics in it that I was really loving the buzz from, but it uses just caffeine from the little bit of matcha in it, so it's very low. And what I found was after my workouts, if I throw one of these back, it like kind of almost boosts the performance of the pre-workout that I had during my workout. It kind
Right.
of helps it like amplify the effect a little bit. So I love it. So I am always looking for things that I can recommend to my clients that are going to be beneficial to their health. And while I love coffee, I do know that not everyone has the caffeine tolerance that I have. I'm a high metabolizer of caffeine. I can drink a lot of caffeine and not have it negatively affect me, but that's not everybody.
Sure.
And there are definitely people who can't have caffeine for whatever reason.
I mean, if you could take me as a surgeon, I drink coffee in the morning and I operate all day long. I don't want to have a 2:00 crash. I want to be able to perform from morning until night.
Yeah, which is where like your 2 p.m.
Exactly. So you could drink this in the afternoon.
Boost.
Some people will drink this in the morning. It depends on what your schedule is.
Yeah, and that is the nice part because they're not super high in caffeine, so you can drink at any time, and you get the benefits of, like I said, the adaptogens and the nootropics. Nootropics are substances that benefit the like firing of your brain chemicals essentially. Right. So they make you think smarter. Yeah. Says the girl who's deep into a prep phase.
They make your mind magical,
they
basically.
Do. Also helps with your immunity. I mean, I have just been so impressed. Right now, they are offering our listeners an amazing discount. If you sign up for the subscribe and save, you get 40% off this cool little box, which I have. I actually saved one for Nils and Sarah because they haven't tried them yet. So I like to share the love. But share the love with all of our listeners. So definitely check them out. It's an amazing company. Dr. Martin gave you the backstory, great benefits, something that a nutritional therapy practitioner can fully support and recommend.
You have a very successful guy in Silicon Valley who made something that's for people's health. I mean, come on, we got to support this. And for all of us who drink too much coffee, me included, you have an alternative now to keep you stable throughout the day. So.
Yeah. So there's a link in our description box below, 40% off if you subscribe, which I highly recommend. It's a huge savings. In fact, we can use the link. Dr. Martin, like you and I can use the link. So 40% off. Keep them in the fridge.
Is Nils using the link?
Oh.
Yeah. Okay. Nils is using it too.
It's like so tempting. I just want to chug this right now, but I'm not going to because it's late in the day and it's dinner time. So.
But your brain would be buzzing at night.
I know it would be. And then
let's
I would
go
sleep.
24 hours a day.
So show Magic Mind some love. And hey, it's like holiday time too. So if you got some people who are on your list, you don't know what to get them, maybe a subscription to Magic Mind.
Yeah. Got it.
Help their health. Help their healthy.
And for a limited time, click the link in the show notes and get 50% off your subscription to Magic Mind using code BEAUTYSURGEON. That's code BEAUTYSURGEON at magicmind.com/beautysurgeon. This offer is valid up to 10 days following the airing of this episode.
That's what everybody's really here for. We're back and they've learned about surgery, they've had surgery, and now the scary part is, what is recovery going to be like? So the best thing you can do is to prepare for recovery before surgery. That's why this slide is called Preparing for Recovery. Read your post-op instructions and review them with your primary.
This is crazy. What are you talking about reading this post-op instructions? Explain this to me, please.
With your caretakers. And I always tell people
with the caretakers? Mm-hmm. What are you talking about, woman?
And this is really beneficial because there are things that, especially with a surgery like this, that is unique and has some very special considerations for recovery that might seem concerning, like my feet are numb. Okay, well, if you had a facelift and your feet are numb,
that's a problem.
That's a problem. If you had a thigh lift and your feet are numbish, that's probably just normal for a few days. So there are very important things that you should be aware of prior to surgery. And true knowledge is knowing that you know nothing, right? So maybe just go into this like, let me get as much as I can. Like, I've not had a thigh lift before. These people who are doing this surgery on me have been through this before. Maybe I should read what they give me.
Yeah.
Please read it.
Please.
Or at least watch this episode.
Yeah.
If you're one of our patients, welcome.
But even if you're not, watch this episode because
Yes.
this will prepare you for your surgery.
Here's a really important one. Know when and where your first post-op appointment will be. We have had, over the course of the last decade and a half, a handful of patients whose very well-meaning spouse drove them back to the hospital for their post-op appointment, and then a fight ensued. And we don't want you to have a blood pressure spike.
We don't want you to fight with your loved ones.
We don't want that stress. So
yeah.
For us, a lot of our patients, their first post-op appointment is technically when they're still in the hospital. Dr. Martin goes to see them the day after surgery. And then maybe their next appointment is the next day on video.
Yeah, we do telehealth the next day after
especially
that.
for a thigh
because we're
lift.
super special.
Getting in and out of the car, not your favorite thing.
Right.
Like, the less we can make you do that, the better. So knowing where and when your first post-op appointment will be is very key. The hospital might write something on your paperwork, which happens all the time. They'll literally just pick a date, and the person will like email or text me like, the hospital said I have a follow-up on this date, but I have it on as this date. Like, yep, that's the date. Fill your prescriptions, please. Fill your prescriptions prior to surgery. Do it. Some of them you might need to take before surgery.
It's good for you.
Yep, just do it. Purchase any of the recommended post-op products. We love talking about the toilet extender
with our logo on it.
Or funnel, body pillow, positioning pillows, etc. Dr. Brian, you take the second column here.
I'm just telling you, we could start an Amazon channel just with a toilet extender. You know,
Yep.
We could make so much money. We should just crowdsource it and make all the listeners rich. Everyone gets rich off our toilet extender. All right. So second row, consider purchasing support pillows to facilitate better sleep positioning. Amy has a really good pillow system. You can just respond with the DMs on this video or just email her. She can give you some ideas for that.
Because sleeping will be a challenge. Getting
really
comfortable
hard.
sleeping.
It's hard to sleep on your back. It's sometimes hard to sleep on your side.
You also need to have your legs supported.
Yeah,
you need to be slightly in a curvature.
You can't really sleep on your stomach, and it's just kind of a disaster. Yeah. So think about what you use on a daily basis and move items to be close to waist level. Amy's so good with this, and she's so amazingly like spatially gifted. She's like, don't forget to move this random object, which I would never have thought of. So you need to really almost preemptively go through and create like what it's going to be like and find out what those things are. That's,
anything you have to crouch for, you need to move up.
Suck. Yeah. And even reaching high hurts too, right?
Yeah.
So it has to be at that waist level or at chest level.
Yeah. Specifically things though for this that you have to bend over for or crouch down to get, like cleaning supplies that you keep underneath a bathroom counter. Move that up.
Yeah. Plan on a few days of easy to put on clothes. Think Snoop Dogg next episode, like things that are loose, easy fitting to slide on.
Specifically, slip-on shoes will be that is the only way forward for several weeks after surgery. So definitely easy to put on shoes and easy to put on clothes.
It's normal. It's normal to be nervous
and excited.
It's normal to be excited, and you should be excited. So this is an awesome surgery. You got to climb a little bit of a mountain, but you will get there.
People ask us all the time, like, I'm nervous. Like, should I be nervous? Like, yeah, you should be nervous. You're having surgery.
Yeah.
Like, but you should also be excited. And that's almost always what's followed by, but I'm so excited. Like, I can't wait. If you weren't nervous at all, we might question that a little. You're having a big surgery.
Right.
I'd be nervous if I was having a thigh lift. I'd be excited, but I'd be nervous.
Yeah.
Like, whew, it's gonna
Totally.
be like, we're going to war. Like, let's do this. All right. So let's talk about the stages of recovery because it really is. And I think people think like, oh, it's been a week. I should be healed. Or even it's been 4 weeks and my incisions are closed. I should be healed.
So the crying phone calls usually happen about 3 weeks out.
Or I was going to say 6 weeks out.
3 to 6 weeks.
Yes, because in my mind, you are in the very acute recovery phase for 12 weeks. Like that's when you're still like acutely recovering. You haven't even made it. You're newborn. You haven't even made it into like 6 month and beyond stage. So knowing in your mind that especially with this procedure, like this is a long recovery period, but it's not terrible that whole time.
Terrible.
But things are happening that whole time. Like
yeah. By the way, if your operative surgeon, God bless them, said that it's a quick recovery, they're absolutely lying to you unless they do some unknown procedure that doesn't exist.
Well, you might be feeling good quickly.
Yeah, you'll
but that
feel
doesn't
good.
mean that you're recovered quickly.
But like you have difficulty sitting, you have difficulty sleeping, you have difficulty moving around. And you could be fine at 4 weeks and then you do some movement with your leg and you feel this pull and shooting pain.
Yeah.
You could be out in public and you feel a shooting pain in your groin.
Right.
This is not a good situation. So I think that you have to give yourself a little bit of grace and relax and just accept the fact that this is going to be a slow growing process.
Yeah.
Take it from two people that are super motivated, don't like to be not in control. You have to let go a little bit.
Well, and that you're normal. Like this is not a speedy recovery. So initially swelling, tenderness, discomfort along the incisions. You can have kind of that burning sensation everywhere. Things can feel very uncomfortable. Dr. Martin said bruising. Bruising is a thing. You will have bruising. Temporary numbness or changes in skin sensation. Absolutely. Even just having the local anesthesia put in an area, the effects of that can diffuse and like spread. Your hips might feel really numb. Like those are totally normal things. That's just the very initial things you're going to feel, and swollen, right? And sore. And then, 1 week passes and people think like, well, great, I'm going to feel great. Week 1, very limited activity aside from walking. And as I said in the very first slide, I think of episode 1, you will walk. Independently mobile, you will walk. Mm-hmm.
The worst thing you could do after the surgery is not walk.
Yep. Or not walk enough.
You can sit there and if you're listening to this now and you're convincing yourself that I'm not being correct or telling the truth, you're lying to yourself.
You will walk.
If you don't walk, you will swell like crazy. Your recovery will be longer, and then you put yourself at risk for blood clots. So, you have to think to yourself, I got to walk after the surgery, obviously with help and within reason. You don't want to like walk and do like lunges or something like that. But the movement is therapeutic. It will help you heal. It will stimulate the lymphatics. It will decrease swelling, decrease bruising, decrease pain, and then get your blood circulation going, which helps with healing, helps your scar. You will recover faster if you walk.
My goodness, yes. Do you know what muscle is called the heart of the leg?
Mm-mm.
It is the soleus.
Oh, the soleus. Yeah.
Because the soleus, it's shaped like a fish. That's why
I
the
knew
soleus.
it.
But it pumps blood back up. So when you have a surgery on a dependent limb, right, away from your heart and it's fighting gravity, like that walking motion happens by flexing at the ankle, by really getting that walking happening. So
Which is what SCDs do, those little
Yeah.
huggy pumps that you wear at the hospital.
Mhm. So sleeping with a lot of pillows in a very supported position is going to be absolutely the first few weeks.
Yeah, week 1, you'll definitely take pain medications and muscle relaxants. Hopefully you get off those quickly.
And it might be over-the-counter pain
Yep.
medication, but you're definitely taking some Tylenol.
You're going to avoid stairs and sitting for sure. That's going to not come for weeks. So you're not going to be sitting well for weeks.
Yeah.
What about week 2 to 3, Amy?
Weeks 2 to 3, depending on what you do for work, you can probably return to work. Now, if your work requires you to sit all day, you're going to have to get some modifications.
If your work requires you to do the splits, you're not going back for a while.
No, if you are an athlete, you won't go back to work for a while.
I don't know what that would be, but
You're going to have more range of motion, but still limited sitting. Like I said, you will not be sitting at a 90-degree angle for quite some time. And you can get back at that point to some upper extremity exercise. Like sometimes people are surprised, like, yes, like I'm fine with you getting back in the gym and doing some upper body.
Let's start getting those
Yeah.
biceps going, triceps.
Right? Stuff
Yeah.
you can do standing. Absolutely.
Sure.
You won't
Don't want
be
to lose your gains.
Yeah. Well, and just in general, like that's going to help with healing overall, getting some good endorphins going.
And it'll help your brain.
Yep. Helps your brain, helps you feel like you're doing something. Weeks 4 to 6, you can start to gradually increase activity. Most patients can drive around week 4, making sure that
You could
have,
drive before then, but the problem is safety, right? You're driving and all of a sudden...
Well,
you
you're
have-
not sitting upright. You're leaned way back like you're in a low rider.
Right,
Because
and
you
then-
can't sit upright.
Right. And then you have some pain and you like react and then
Right.
you cause a wreck. So
Or you can't
we're
move your foot.
we're very conservative about letting people drive, but I mean that's our practice. I mean,
Well, that's for safety. I mean,
Yeah.
again, if we tell you can't like sit straight up and you are driving in a very compromised position, that's not a great idea. So I always tell people you can drive when you feel safe driving. You can move your foot quickly enough. You're not having pain. You're not on pain medications or muscle relaxants. And you can safely drive. You can see, you can be safe driving. So having that, again, expectation is key in your mind that I probably will not drive myself for a month and I will maybe need help picking kids up from school and things like that. If you're driving it 3 weeks, awesome. That's great.
I wish someone would drive me around. He used to drive me to Aspen.
I know.
You know.
I was your chauffeur.
It's
for
not
a
that
long
bad.
time.
I don't know why people are fighting this. Like, yeah, please drive me to my next
Yeah.
place.
I mean,
Thank you.
honestly, if
It's an Uber you're not paying for.
if
Why
all
is this
it
bad?
took to get you places on time was for me to drive you there,
I
like
know.
I'm done. I'm
Oh,
down.
trust me. We're getting to that point where I may have to have
That's
a driver.
that's
Yes.
yeah. I know.
And that
That's
would
why I
be
say
awesome.
that. Yeah, I got you.
I would feel bougie, but I would love every minute of
Can
it.
I get my Jeep back?
Yes.
Yeah. All right. So you can return to most upper extremity exercises and activities by that point with very few restrictions.
Yeah.
So by week 6, and this is longer. If you go back and listen to some of our other breakdown episodes, most of these things might be happening at weeks 2 to 3 or even
Yeah.
week 1 for some of this. So at week 6, if this is just where you are fine. Like you are doing great. You are right on schedule. You are doing great. Week 7 and beyond, you're going to slowly return to some of your lower extremity exercises. Slowly meaning as tolerated with your pain and range of motion. The last thing you want to do is have all this work done, have this awesome surgeon suture everything up nice and tight, and then
You messed it.
bust through it.
Yeah.
And again, it's not ever a patient's fault, but or if you go back to doing something where you have the potential for falling or injuring yourself
Right.
before you're cleared.
Walking the dog, stumbling down the stairs because you have too many opioids
Skiing.
on board.
Yeah. Riding your bike. Like those are things that
I
might
had
be
to do
beyond
my
week 7
my yoga or my Pilates. No, you didn't. You really didn't.
Yeah.
Yeah.
when it
So-
hurt. Sitting on any surface. Oh, these are the big wins when a patient comes in and says, I sat on a bench. And that might not seem like anything to someone who's not had a thigh lift, but to someone who has, they know what that means. Like you sat without a pillow underneath you, like you are feeling good.
We have such a weird job.
We do. We have a weird job. Like our word is, Dr. Martin, what's the last thing you can expect?
Yeah. The most important thing, love your results. By the way, things that are arduous to get through make you feel better.
Yes.
Okay. Losing weight is hard, right? Going to medical school, don't advise it, is hard to do, but you feel good when you're done with it, right?
Yes.
Doing your life challenge
Right?
and your
Feel
photo
good.
shoot, that is
Yeah.
hard to do. And you feel good afterwards. Thigh lift patients
I'll let you know.
are pumped up when they start feeling better and they look good, right? It's a process. It's worth it. It's worth the money you spend. It's worth the recovery. But when you're done with it, love your results.
Yes.
Be happy about it. That's awesome.
Yeah. It is a tough recovery, but it's not insurmountable. And I always say, like, the best surgery you had is a surgery you had 2 weeks ago. So once you decide, like, yes, I'm going to do my thigh lift, like, don't perseverate about the recovery. It'll pass really quickly. Like, just get it done. Like,
Yeah.
love your results. Like,
Yeah.
get on with it. Like, get on with your life. Like, you have worked hard to get to this point, and you will continue to work hard to get through the rest of your life because life is hard.
And if thigh lifts were so insurmountable, we wouldn't have people coming every week requesting this surgery. I mean, it is people, we tell our patients they are good with the recovery, they get through it and they're happy, right? They're not telling all their friends the worst thing I ever did,
Nope.
you know? So
Get yourself a bombshell
yeah.
booty pillow and a funnel, and you're good to go.
bombshell booty pillow. Okay.
Bombshell booty pillow. They're not sponsored. They found us on TikTok.
Okay.
It's weird, but they're great. All right, Dr. Martin, this was great. Now we all get to go eat some turkey legs. It is Thanksgiving. I hope everybody really enjoys their
Is it, or is
Thanksgiving.
it Thanksgiving pass?
Nope, it's the 15th. It's November 15th.
Oh, yeah.
Yep.
Okay, good.
So Thanksgiving is coming next week.
Sweet.
If you need crazy recipes to use your Element electrolyte powder, hit me up because I'm already in that process. Like, I am making some citrus turkey breast and some salted chocolate caramel tart.
Basically, you just need to deep fry the turkey. That's all you need to do. Screw all this other stuff.
Right. It's
All
such
right.
an awesome part. All right. So thank you so much, everyone, for listening. If you've made it this far, we love you and we really appreciate you being here. We're very thankful for you listening. Very, very thankful. Leave us a like, a comment, a rating, a review. You can find us on all our social media handles right here. Here they are. They all show up like magic. We also have a phone number you can call and leave me voicemails.
303-630-9038.
Or you can text me. Leave us your questions. We have some exciting stuff.
How many voicemails have you gotten, Amy?
I get a handful. Yeah, more when I ask.
Okay.
I get a handful.
All right.
I don't want to brag. I get some.
I got a girlfriend in Canada. Yeah.
Yeah. So just to
Niagara
finish up,
Falls. That's where she lives.
right? December is almost upon us, which means it is almost time for our favorite episode of the year, which is our top 5. If you haven't listened to our top 5, and actually the Nils mashup from last year is its own video. It doesn't have that many views, and I think most of them are from me watching it and showing it to people because I love it. It is. It's like 8 minutes of like the best of. So hopefully we'll get another one of those this year. And also, I'm throwing this out there, the monster at the end of this book style. December 1st, I'm going to finally talk about Best Year of Your Life Challenge. So
Oh, I got to start talking about mine too. Yeah.
So that is coming. So hang with us through the end of the year. You can make it. We will support you through the holidays. If you're like super stressed with all your family, just throw on some Beauty and Surgery podcast and listen to us talk about candy corn and like random stuff.
Just play it during
Yeah.
Thanksgiving dinner.
Watch the Nils mashup.
Yeah.
No, there's football on during Thanksgiving. Don't
That's
play
right.
us
Beauty
during
and the
football.
Surgeon. That's good.
Play us the day after. All right, everyone. Thank you so much. And we will see you here next time.
Thank you so much.